Hemorrhoids. Hemorrhoids are a relatively common condition that affects roughly half of all individuals, even those beyond the age of 50. After applying home remedies to treat hemorrhoids and changing their lifestyle, the majority of people notice an improvement in their hemorrhoid symptoms. Hemorrhoids come in a variety of shapes and sizes. Hemorrhoids are divided into 4 categories. 1. Hemorrhoids on the outside. They are directly on the surface from where the stool emerges on the anus. They are not always apparent, however they might appear as lumps on the anus's surface. Hemorrhoids on the outside are usually not a severe medical issue. Internal hemorrhoids are a type of internal hemorrhoids. They are frequently found in the rectum and cannot always be seen from the anus because they are too deep. Internal hemorrhoids are normally harmless and disappear on their own. 3. Hemorrhoids that have prolapsed. Internal hemorrhoids swell and adhere to the anus, resulting in prolapsed hemorrhoids. Outside the anus, prolapsed hemorrhoids appear as red, bloated lumps or pimples. 4. Hemorrhoids that have thrombosed. A blood clot within the hemorrhoid tissue causes a thrombosed hemorrhoid, which can cause lumps or swelling around the anus. Internal and external hemorrhoids can potentially develop blood clots. Symptoms of hemorrhoids. Hemorrhoids have different symptoms depending on who you are and what sort of hemorrhoids you have. 1. Hemorrhoid symptoms in general. The following symptoms may emerge in the case of hemorrhoids in general. Bleeding that is not painful during a bowel movement. You may observe a small amount of bright red blood on the toilet paper or in the toilet bowl from time to time. Irritation or itchiness in the anus area. Discomfort or pain. Outside the anus, visible and bulging hemorrhoids. Angioedema, swelling around the anus. A lump at the anus that is unpleasant or extremely sensitive. Leakage of feces. 2. Different types of hemorrhoids have different symptoms. The symptoms of hemorrhoids vary depending on where the hemorrhoids are located. Internal hemorrhoid symptoms. Hemorrhoids in the rectum have no visible or palpable symptoms, and they normally do not cause pain. When passing stool, however, straining or scorching the delicate outer surface of the hemorrhoid might cause bleeding. Internal hemorrhoids can sometimes flare out, especially when you exert yourself. Protruding hemorrhoids, also known as prolapsed hemorrhoids, can cause pain and irritation. External hemorrhoid symptoms. One of the most noticeable symptoms of hemorrhoids is irritation, which can result in itching or bleeding. A thrombus can occur when blood stretches the external hemorrhoid and draws it inward, causing extreme discomfort, edema, and inflammation. Hemorrhoids, causes and risk factors. Pressure causes the veins around the anus to constrict and swell, and swollen veins can occur as a result of too much pressure in the lower rectum. Hemorrhoids are caused by a variety of factors. Hemorrhoids can be caused by a variety of factors, including the genetic component. Aging, as the rectal and anal veins supporting tissues weaken and contract with age. Factors that make you more susceptible to illness. One of the following reasons can cause hemorrhoids. Effort expended during bowel movements. Sitting on the toilet bowl for an extended period of time. Constipation or diarrhea for a long time. Overweight. Being pregnant. Sexual analgesia. Hemorrhoids complications. Complications are uncommon, however if they do arise, they may include the following. Anemia. Anemia is caused by chronic blood loss as a result of disease. Hemorrhoids get strangulated when the blood supply to them is cut off, causing them to suffocate, causing intense agony and finally tissue death, necrosis. Hemorrhoids diagnosis. The prognosis is different depending on the type of hemorrhoid. Hemorrhoids diagnosis. The doctor makes the following diagnosis. Diagnosis of external hemorrhoids. Only the proctologist can diagnose external hemorrhoids. Diagnosis of primary internal hemorrhoids. the doctor must enter his finger into the rectum while wearing a rubber glove. Diagnosis of advanced internal hemorrhoids: the doctor examines the lower intestine and rectum by anoscope is a type of anoscope. Proctoscope is a type of microscope. Sigmoidoscope is a type of ophthalmoscope. These endoscopes are flexible, illuminated tubes that allow the doctor to examine the anus and rectum from the inside. Cases in which a colonoscopy is required. More extended and thorough examinations of all regions of the gut with a colonoscope may be required for diagnosis. The following conditions necessitate a colonoscopy. Symptoms and symptoms in the digestive system indicate the existence of another disease, digestive system. There is a substantial chance that the person getting the examination will acquire large intestine cancer. The person being examined is over 50 years old and has not had a colonoscopy in the last 10 years.